Hello, I'm Dr. Science. Statins, to use or not to use, that is the question. Statins are the most contentious medications. One side claims that taking statins is actually detrimental, while the other claims that they are a miracle medication that would rid the world of cardiovascular disease by lowering LDL cholesterol. Furthermore, the notion that statin prescriptions be reconsidered is disregarded as a conspiracy theory. Indeed, as a medical resident, there was a time when I would just nod my head at the graph displayed by a pharmaceutical company, claiming this is how statins reduce cardiovascular disease. However, after reading several papers, I am persuaded that statins are the medications that should be taken seriously. Let us first define the terms primary prevention and secondary prevention. Primary prevention refers to actions taken before a disease develops. Secondary prevention is the process of keeping the disease from worsening after it has been contracted. This is a crucial idea to understand before discussing when to use statins. According to the American Heart Association, if LDL is 190 or greater, medication should be taken. Aside from that, if you have cardiovascular risk factors such as diabetes, you should take medications regardless of your LDL level. Furthermore, it emphasizes high intensity therapy, which reduces LDL levels by higher than 50%. In the United States, the LDL target for those with underlying cardiovascular disease is less than 70. When you take statins, your LDL drops dramatically. However, decreasing LDL reduces cardiovascular death and increased lifespan. A detailed review of 60 clinical studies involving 320,000 persons was undertaken. When it comes to extending life, it is either lowering LDL to less than 30% or drastically lowering it to more than 50%. It's pointless. When LDL was reduced by more than 20%, cardiovascular death was comparable to when it was reduced by less than 20%. Even in absolute terms, decreasing LDL below 100 had little effect on extending life. At this point, it appears that the rules for unconditionally lowering LDL should be revised. When we gathered trials and examined how much statins increased longevity, we discovered that statins extended lifespan by 3 days for primary prevention and 4 days for secondary prevention due to disease. The average research duration was 4.5 years. Thus, taking it for the remainder of your life will add around 1 month to your life. I don't think this degree of anticipation is sufficient to take statins. The ultimate goal of medicine is to reduce death. We invested in taking medication and saw a significant reduction in the risk of cardiovascular disease, but the overall return was lower than planned. This could be seen as a negative profit in other disorders. Let us now summarize. The primary
Oh,
goal of statin therapy is to prevent cardiovascular disease. However, we must depart from this viewpoint. Let me explain 4 reasons. For starters, primary prevention is less effective than anticipated. Second, while it reduces moderate heart disease, the benefit in fatal situation is small. Thus, it does not considerably lower the risk of cardiovascular death. Third, it is not very effective in extending life. Fourth, when the money spent on statins over time and the side effects are considered, their cost effectiveness is low. JAMA stands for the Journal of the American Medical Association. It is one of the most prestigious medical publications. Consider a thorough examination of clinical trial data from 270,000 patients. The researchers used those who had the greatest reduction in LDL with high dose statins as a baseline. How much were the risks of overall and cardiovascular death reduced? It's only 0.6%. However, According to the paper, statins are still preferable. Results vary depending on the LDL level prior to therapy. Regardless of LDL, statins had no effect on total mortality risk in terms of primary prevention. Only for secondary prevention is it indicated that there is a noticeable advantage when the baseline LDL is greater than 160 and is reduced to greater than 65. To find out this information, however, you must go to the appendix and read through the fine print. It's like asking us to read the insurance terms. Following this, the conclusion is that statins should be used. Isn't this an oversimplification? The myth that elderly people incur a loss if they don't take statins properly has been debunked by following study. 100,000 others over 65 were poor. Over a period of more than 2 years, the individuals were split into two groups. One complying group, which took statins more than 80% of the time, and one non-compliant group, which did not. Myocardial infarction rose by 36% and coronary artery disease by 43% in the non-compliant group. Well, we suppose we'll have to give him more spanks and force him to take the medication more consistently. Oh, this is not the study's conclusion, though. Those who did not take the medication had a 15% lower overall risk of dying. It's like we had a
What?
longer life because we disobeyed our teacher. I had to give it another look to be sure the description wasn't wrong because it was so different from what we had anticipated. But when you look at this by age or gender, it makes more sense. First off, the death rate was reduced by 22% for people over 80, whose prescription was reduced or stopped. Men who do not take their medications as prescribed had a 23% higher death rate, whereas women have a 19% lower death rate. In other words, people over the age of 80, as well as older women, should reconsider taking statins. Look at this fixed out now. Persons with cardiovascular disease, some patients with diabetes or high blood pressure, persons with chronic renal disease, metabolic syndrome, rheumatoid arthritis, and chronic obstructive pulmonary disease could all benefit from statins. It may be preferable to take medication among these people, particularly middle-aged men aged 40 to 65. Statins, for example, lowered cardiovascular risk by 41% in patients with chronic renal disease. The overall risk of death was cut by 34%. How are things going? At the time, life expectancy had been prolonged to the point where cardiovascular disease had been minimized. Between 1999 and 2006, the average LDL level in Americans fell from 126 to 115. Furthermore, the usage of cholesterol medications climbed by more than 5%, from 8% to 13% of the overall population. During the same time span, however, the incidence of myocardial infarction and stroke increased by 0.3% and 0.9%,
Oh,
respectively. There was no link between statin use and lower cardiovascular mortality in Western European nations from 2000 to 2012. Of course, blaming statins alone for the rise in cardiovascular disease may be unfair. However, it implies that the effect is minor or that the prescription's objective is incorrect. I emphasize this once more. Unconditional LDL reduction is not a solution. My conclusion is that it is best to avoid taking statins by not having cardiovascular risk factors. If you fall into a risk category, you must thoroughly assess numerous factors other than LDL before beginning treatment. Now, next time, we'll go over the statin adverse effects that you should be aware of. I sincerely hope you see it. If you enjoyed it, remember to subscribe and like. Saludos!